Hello, my friends, my family, and my fans. I'm Andrew Ditch. I have been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as noncompliance or argumentative rather than part of their intellectual disability or developmental disability. What is examples of this to help prevent mistakes? Take me into a therapy session to help provide examples. Use trauma therapy without understanding autistic trauma pathways. This can worsen symptoms instead of helping. Below is a walkthrough of what actually happens inside a therapy room when trauma therapy is delivered without autism-specific expertise, followed by corrective versions that show how to prevent those mistakes. This gives you a clear, lived experience view of what goes wrong and what good care looks like. I'll take you into the room, moment by moment, so you can see the difference. New Moon Scenario 1. Therapist misreads, shut down as avoidance. Crossmark incorrect, non-adapted trauma therapy. Therapist. Let's go back to the moment you felt unsafe. Describe the emotions in your body. Autistic client. Stares at the floor, breathing shallow, goes quiet. Therapist. You're shutting down again. This is avoidance. You need to stay with the feeling. Client. Quiet, frozen, unable to speak. Therapist. You're resisting the work. Trauma therapy only works if you engage. What's actually happening? The client is in sensory/emotional overload shutdown, is a neurological freeze response. Not avoidance. The therapist escalates pressure, worsening the shutdown. The client leaves feeling ashamed, misunderstood, and unsafe. Why this is harmful? Reinforces trauma, increases masking, makes the client afraid to return, confirms the belief that therapy is unsafe. White heavy checkmark corrected, autism-informed trauma therapy. Therapist. I notice you got quiet. That could be a sign of overwhelm. Let's pause. Client. Nod slightly. Therapist. We can slow down. Would it help if we switch to grounding or take a sensory break? Client. Relaxes a little. Therapist. You don't have to describe emotions verbally. You can point to a chart, right? Or describe sensations instead. Why this works? Recognizes shutdown as a trauma plus sensory response, reduces pressure, offers alternative communication, builds safety and trust. New Moon Scenario 2. Therapist pushes verbal emotional processing. Crossmark incorrect, non-adapted trauma therapy. Therapist. Tell me what you felt when that happened. Autistic client. I don't know. Therapist. You're avoiding your emotions. Try harder. Client. I really don't know. Therapist. This is emotional repression. We need to break through it. What's actually happening? The client has alexithymia, difficulty identifying emotions. The therapist interprets this as resistance. The client feels blamed for a neurological difference. Why this is harmful? Increases shame. Rain forces the idea that the client is broken, makes trauma therapy inaccessible. White heavy checkmark corrected, autism-informed trauma therapy. Therapist. It's okay if you don't have words for the emotion. Many autistic people experience emotions as sensations first. Client. Relieved. Therapist. Let's try a different approach. What did your body feel like? Tight? Hot? Heavy? Numb? Client. My chest felt tight. Therapist. That's great information. We can work with that. Why this works? Uses somatic cues instead of abstract emotional language. Respects autistic processing. Builds confidence instead of shame. New Moon Scenario 3. Therapist uses exposure without sensory understanding. Crossmark incorrect, non-adapted trauma therapy. Therapist. We're going to revisit the traumatic memory and stay with it until the anxiety goes down. Autistic client. Starts rocking, covering ears, breathing fast. Therapist. Stay with it. Don't pull away. This is how we rewire the brain. Client. Tears up, begins to melt down. Therapist. You're being reactive. You need to tolerate distress. What's actually happening? The client is in sensory overload, not emotional avoidance. Exposure is triggering a meltdown. Not healing. The therapist is confusing sensory trauma with emotional trauma. Why this is harmful? Creates new trauma, reinforces fear, damages trust, can cause days of burnout. White heavy checkmark corrected. Autism-informed trauma therapy. Therapist. We're going to approach this memory gently. If your sensory system gets overwhelmed, we stop immediately. Client. Nods. Therapist. You can signal me with a hand gesture or card if you need a break. Client. Relaxes. Therapist. We'll use titration, touching the memory for a moment, then grounding, then returning only if you feel safe. Why this works? Recognizes sensory overload as a trauma trigger, uses pacing and titration, gives the client control, prevents meltdowns and re-traumatization. New Moon Scenario 4. Therapist misunderstands masking trauma. Crossmark incorrect, non-adapted trauma therapy. Therapist. You say you're exhausted, but you seem fine. Let's explore why you think you're struggling. Autistic client. I'm masking. Therapist. That sounds like avoidance. Let's challenge that belief. What's actually happening? Masking is a trauma response, not a belief. The therapist invalidates the client's lived experience. The client learns that honesty is unsafe. White heavy checkmark corrected. Autism-informed trauma therapy. Therapist. Masking takes a huge toll. Many autistic adults describe it as a trauma in itself. Client. Tearful, relieved. Therapist. We can explore how masking protected you and how it also harmed you. You don't have to mask here. Why this works? Validates autistic trauma, builds safety, allows authentic communication. Glowing star, the core insight. Trauma therapy becomes harmful when clinicians assume. Shutdown equals avoidance, meltdown equals anger, alexithymia equals resistance, sensory overload equals emotional dysregulation, masking equals coping skill, literal communication equals lack of insight. Autistic trauma pathways are different. Without understanding them, therapy can re-traumatize instead of heal. With autism-informed adaptations, therapy becomes safer, slower, sensory-aware communication, flexible, respectful of neurology, effective. 1. Autism-specific expertise. What it actually means a clinician with autism-specific expertise understands. B. Sensory profiles, identifies sensory triggers, adjusts environment. Lighting, noise, seating, integrates sensory regulation into treatment. Below is a deeper, clearer, and more practical expansion of what autism-specific expertise actually looks like when it comes to sensory profiles. This is the kind of detail that helps clinicians, agencies, and training programs understand what competent autism-informed care really requires. I'll break it into what the clinician understands, what they do in practice, and what it looks like in a real session. Glowing star 3. Autism-specific expertise. What it actually means. B. Sensory profiles. A clinician with autism-specific expertise doesn't treat sensory issues as preferences, quirks, or behavior problems. They understand that sensory processing is a core part of autistic neurology, and that sensory overload can drive anxiety, shutdowns, meltdowns, trauma responses, and communication difficulties. Here's what that looks like in real practice. 1. Identifies sensory triggers. A clinician with autism expertise actively works to understand the client's sensory system. They ask concrete, specific questions like, what environments drain you the fastest? Are there sounds, lights, or textures that overwhelm you? What sensory signs tell you you're getting overloaded? What helps your body feel calmer or more regulated? Do you notice changes in your thinking or speech when you're overloaded? They observe. Increased fidgeting, covering ears, avoiding eye contact, looking away from bright lights, changes in speech, quieter, monotone, or loss of speech, signs of shutdown or freeze. They understand. Sensory overload is not anxiety, sensory seeking, is not hyperactivity, sensory avoidance, is not defiant, sensory pain is real pain, not overreaction. This allows them to interpret behavior accurately instead of pathologizing it. 2. Adjust the environment, lighting, noise, seating. A clinician with autism expertise modifies the therapy environment to reduce sensory load. They adjust lighting. Turn off fluorescents, use soft lamps, avoid backlighting noise. Closed doors, use white noise machines, avoid loud HVAC system seating. Offer options: chair, couch, floor, rocking chair. Allow movement, pacing, or stemming visual clutter. Keep the room simple and predictable temperature. Offer blankets or fan session structure. Predictable pacing, clear transitions, written agenda. They also allow sunglasses, noise-canceling headphones, fidgets, weighted items, AAC devices, movement breaks. These adjustments aren't special treatment. They are accessibility. 3. Integrates sensory regulation into treatment. A clinician with autism expertise understands that sensory regulation is part of emotional regulation. They incorporate grounding through sensory tools, deep pressure strategies, movement breaks, breath work, adapted for sensory needs, predictable session rhythms, sensory-friendly coping strategies, co-regulation that respects sensory boundaries. They avoid forcing eye contact, forcing stillness, forcing verbal processing during overload, exposure to sensory triggers as treatment, mislabeling sensory distress as anxiety or behavior. They teach how to recognize early signs of overload, how to build a sensory safety plan, how to use sensory supports proactively, how to communicate sensory needs without shame. Sensory regulation becomes part of the therapeutic process, not an afterthought. What this looks like in a real therapy session. Example session: sensory-aware trauma work. Client: I'm starting to feel overwhelmed. Autism competent clinician: thank you for telling me. Let's pause. Do you want to dim the lights or take a movement break? Client: lights off would help. Clinician: turns off overhead lights, switches to soft lamp. Better? Client: yes. Clinician: let's check in with your body. Are you feeling sensory overload, emotional overwhelm, or both? Client: mostly sensory. Clinician: okay, we'll stay with grounding until your system settles. You can use your headphones or fidget if that helps. Client: uses headphones, breathes more evenly. Clinician: when you're ready, we can continue, or we can shift to a lighter topic. Why this works. The clinician recognizes sensory overload as a neurological event, not avoidance. They adjust the environment. They integrate sensory regulation into the session. They give the client control. They prevent shutdown or meltdown. They protect the client from re-traumatization. This is autism-specific expertise in action. Glowing star: the core insight. Autism-specific sensory expertise means the clinician understands that sensory overload is a safety issue, not a preference. Sensory regulation is part of emotional regulation. Sensory needs must shape the therapy environment. Sensory overwhelm changes communication, processing, and behavior. Sensory accommodations are essential for accurate diagnosis and effective treatment. Without this expertise, therapy becomes overwhelming, invalidating, or even harmful. With it, therapy becomes accessible, safe, and genuinely healing. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.